Ladies and gentlemen, please join me in welcoming to the podium our keynote speaker for this afternoon, Dr. Kenneth R. Maloney, President and Chief Executive Officer of Highmark.
Good afternoon, everybody. Please eat your food so you don't get indigestion when I talk. It's a pleasure to be here today. I have to tell you, I'm pretty nervous, though. When the Reverend stood up here and gave the benediction, he made me really scared when he said that God was looking to me for answers on health care. Basically 2,000 years ago. To just give you a couple of statistics so you're aware of what's happened over the last 2,000 years. 2,000 years ago, the average lifespan in the world was about 27 years of age. So if you put that into your frame of reference, you would live 27 years on average if you were born 2,000 years ago. And for 1,900 years, there was very little change in lifespan. In fact, in 1900, the average lifespan in the United States was 47 years of age. So we gained about 20 years of life over 1,900 years in the world of innovation and a focus on healthcare services. And for 1,900 years, healthcare was delivered to people who needed healthcare services by professionals who were designated as healers or doctors or whatever it might be, and it was paid for by individuals. Now, typically the first 1,800 years, they either paid in some form of monetary denomination that they had in their continent or in their country, or they paid for it by bartering. So it was done by individuals who had wherewithal to get health care services. They bought that, and most of it was done in the home. In the 1900s, something major happened in the world, and the United States became the leader in the world economically. And things began to happen. Innovation began to happen. Innovation in the United States, which moved out to the rest of the world. And not only did it happen in industries like steel, aluminum, glass, all those types of things, but it also happened in healthcare. We became the world leader in healthcare in 1900. The United States was so strong economically that it began to spend a lot of its extra money on healthcare in an effort to improve longevity and the well-being of its people. So we became the powerhouse, and that was the focus of what we did in the 1900s. And we paid as individuals. And at that time, we started to see hospitals forming, places where people could go and get care. Because we had money, we started to donate money to the religious sector, or philanthropists donated it to the establishment of hospitals. And so we saw these private hospitals forming in our communities back in the early 1900s. Prior to that, the only hospitals of any sort were publicly based hospitals that people could access if they needed care and didn't have the financial wherewithal. For those who had the financial wherewithal, we began to see private hospitals forming through philanthropy in the religious sector. And so we had things called voluntary hospitals. Also in the 1900s, medicine started to materialize. Doctors began to form and organize. And so the AMA took hold and began to advance their causes in medicine. The next biggest time frame for us was the 1920s, late 1920s, 1929 to be specific. Anybody know what happened in 1929? It was a Great Depression, right? The stock market crashed, we had the Great Depression. So like today, we had a major economic downturn in the United States. And with that came a lot of illness, a lot of need in the public sector for healthcare services. What happened was that the private sector that we had was losing patients and losing revenue to the public sector. The public sector was overloaded with patients and couldn't take care of them. And so our government stepped in and tried to resolve the problem, the issue of access, people not being able to get access to healthcare services, the issue of affordability. People couldn't access the healthcare system because they couldn't afford it. And so in the late 1920s, early 1930s, the administration, it was President Roosevelt, stepped in and was going to propose national health insurance for everyone. To bring everybody in, tax the public, and make health care available to those who needed it by creating this vehicle called insurance. It just so happened that his son-in-law's father was a physician who was active in the AMA. And that individual convinced President Roosevelt not to attach national health insurance to the Social Security Act. So instead, we got Social Security, which was a way to give us some financial wherewithal as we aged, but we did not get a national health insurance program. Instead, he turned to the community and asked the community to come up with a response, and so they did. The hospitals and the doctors responded to avoid the establishment of national health insurance. The hospitals got together, and on a local basis in their markets, they created insurance plans for hospital services. Those later became known as the Blue Cross plans throughout the United States. The doctors, not to be outdone, started their own insurance products for physician services throughout the United States, and those became known as the Blue Shield plans. And therefore, that was born the private healthcare system of the United States. We had private hospitals, public hospitals, doctors who created our insurance vehicle, our financing system, and they did it with a good intent. The intent to serve themselves and the intent to serve the public they were serving. They made it based on fee for service, just like they were accustomed to before insurance. If one needed care, they would get paid a fee for that service, just like they did for the past 2,000 years. And what they did is they made sure that because people were pulled into a large group and we had the financial wherewithal manifesting itself to get good health care, there was the belief that people had the right to health care services that were available in the community on a broad basis, regardless of their financial wherewithal to get them. There were no restrictions to care. People had the right to any health care service they needed to live a long and productive life, and we could make it work. We were a rich country again. We could afford health care. We could spend money on health care, and we could socially accept that principle of a right to health care services without any boundaries and pay on a fee-for-service basis. And what got this program really taking off was in the 1940s, during the war. During that period of time, our government had to intercede in the way employees were paid. And we had to cap employees' wages in the 1940s during the war. A lot of our people were overseas fighting. We had to mobilize a new workforce, and in order to keep things relatively affordable for the government, while we're spending a lot of money on war, they had to cap wages. So in order for companies to survive and attract a talented workforce, to attract the right workforce, they convinced the government to allow them to provide another service to employees in lieu of wages. And so we had legislation passed that made health insurance a component of employee wages. In lieu of increasing wages, companies could offer employees health care benefits. And that made health insurance springboard into the modern times and essentially turned our health care system from one of fee-for-service, privately purchased health insurance to now a system of private insurance sponsored mainly by employers in the marketplace. And that served us extremely well for the next couple of decades, until the mid-1960s, when our country faced another crisis. At this time, we saw two pockets of people in our country who were being disadvantaged by the current system. Healthcare was unaffordable and inaccessible for these two segments of the population. They were those people who had left the employment market and were retired, the over 65-year-olds, and they were the people who weren't working and had no economic wherewithal, the indigent. And so in the 1960s, the government started to look again at the issue of health care insurance and began to talk about developing national health insurance. But again, the powerful, organized unions that we have, basically, in the healthcare sector, the AHA, American Hospital Association, and American Medical Association, fought back on national health insurance, did not want the government to take over that part of the industry, and instead compromised with the federal government to find a solution specifically for those two segments which would mimic the private sector insurance programs. If they were going to accept a government program or a public program, it had to look like the program that was designed for the private sector. And so in 1965, they passed Medicare and Medicaid, designed the same way as private insurance, paid for on a fee-for-service basis, with the same entitlement mentality that was set in place in the private sector, that everyone had a right to the health care services they need, unbounded by any restrictions in what they could access in terms of care. Whatever hospital, whatever doctor, whatever technology might be available should be available to those people who are on Medicaid and Medicare, just like the private sector. And we could do it. It was still affordable for the general public and for the federal and state government at that point in time.